more common in the US than you would think. You may ask, well, isn't this something that you'd see in maybe developing countries or in specific places around the world? Well, to give you a little bit of background, 26.4 women die per 1,000 live births in the US. And to make that worse, 2 to 3 African American women are 2 to 3 times more likely to die in childbirth than white women are. And it's shocking, but the US is the worst developed country with these rates. All other developed countries have lower rates than us. And to talk a little bit more about the African American rates, if you look at this is a graph of the maternal mortality rates for African American women in North Carolina from 1999 to 2013. This line is for African American women, this line is for white women. And the disparities are shocking. And that's in our own state. And they're more likely to die regardless of class, education, or access to care. So a African American woman with a college degree is more likely to die in childbirth than a white woman with a high school degree. So these disparities, as discussed by Fagan and Benfield, and as shown by these statistics, are really shocking. And so the purpose and goal of my project was to understand the causes of maternal mortality in Perinatal Region 4 of North Carolina, which happens to be our region, to examine and compare racial disparities within our region, and to understand circumstances contributing to this problem. And my expected outcomes were basically that if you look at poorer counties within this region, you'll probably find a higher population, a higher African American population, reflecting racial disparities, which would, the fact that the counties are poor could lead to worse health care, and that would present poorer or not as good health outcomes for mothers in these counties. And if you can press the button again, this is the region I'm looking at. Durham and a few other counties are here. It's Perinatal Region 4, and the rest are the other surrounding regions in our state. And my methods took 3 steps. I started out by doing a lot of background research, just seeking to understand the problem and why it's an issue, not just on a local scale, but on a national scale. I also did a lot of data analysis, understanding region data. I also looked at national data, but when I started looking at statistics, I looked more at regional data. And I also tried to make conclusions that would help me come to a complete analysis of why we're seeing what we're seeing in our region, and in our nation as a whole. And so to start off with background research, I looked at a lot of media for stories and statistics to help me understand the problem on a not as deep scale. So I could, as I was starting my research, I wanted to know what is maternal mortality, what are the experiences of people that have been through it, and what scale do we see this in our nation. I also looked at papers that talked about racial disparities and about systemic racism and in healthcare and in other places that often affect the healthcare that Black women receive, and also papers that talked about ways that are being implemented to combat maternal death. Government sites and the NT Department of Health and Human Services provided statistical data that I used to help with my analysis and then eventually my final project. And to continue with the data analysis for my methods, all my data came from birth certificates within hospitals. So I took hospitals, lots of hospitals within Region 4. And all the data came from birth certificates from births that had taken place in that hospital. And the data points that I looked at were gestational age, which is basically a baby's age from conception to birth, and birth weight, which is birth at delivery. And the reason I use these is because these are the most reliable data points that are provided when someone has given birth. And although I wasn't able to get data about the mother specifically, I assumed that when you have lower gestational age or lower birth weight, which shows that they're unhealthy babies, you have mothers and children that are put at worse risk for complications and for death. And so the lower the numbers, the more possibility there is for complications. And that's how I picked my data that I used for my project. And I also looked at hospitals within the region. So for recap, I used gestational age, birth weight, and race. And then I made conclusions based off of those by asking the question, what does this mean for mothers and birth outcomes in these counties that I'm looking at? And for my results, I asked myself 2 questions. How do trends for gestational age and low birth weight correlate with circumstances of the communities that we see them in, that they're associated with? And how do racial disparities factor into this data? So once we look at the general thing, general data, how do we put racial disparities in this equation? And to start off with my analysis, I took each county within Perinatal Region 4 and determined what their economic well-being was. And so I used a scale from the MT Department of Commerce that separates counties into more resources, less resources, and least resources, or by tiers. And as you can see, these are the counties that are in Perinatal Region 4 and how I separated them. And these are the ones with more resources and the ones with less resources, or least resources. To continue with my results, one of the most striking results I found was that if you look at Tier 3 counties, these are the more wealthy, counties with more resources, you find that there's less populations of less African American people in these counties. But as you slowly go to the poorer counties, you find there's a huge disparity between the populations of African American and white people but here they're almost equal. And when I saw that, I was like, wow, so you find more African American people in these poorer counties. But what does that mean for their health care? And that's what I continued to look at as I went through my research. Yeah, and then this is a graph showing the same thing, poorer counties, a higher population percentage of people. And then I looked at the number of hospitals in each county. And you find it's sort of the same story. These are Tier 1 counties, and they have more hospitals. These ones have smaller ones. And you find that in places like Durham and Orange and Wake, you have UNC and Duke and major hospitals that are excellent, and provide excellent care. But other counties don't have that. So that was interesting to see. And then for low gestational age, or now we're getting into the health data points. The trend wasn't as clear, and you can see that in some of the counties there are definitely less. Pearson was an outlier. It actually wasn't really represented correctly in the data because there was one birth for that particular county in that particular hospital, so it didn't work. But that was an outlier. But you sort of see that in these other ones, there are definitely lower rates. And the other thing to keep in mind that's really interesting when you look at this data is hospitals like Duke and UNC are probably going to attract sicker children because they have such good health care. So sometimes you see higher rates of issues in Durham and in Orange because that's where babies come to get taken care of. So that was something that I found to be interesting when I was looking at my data. And you see sort of the same thing here in Durham and Orange County and Wake. You see higher rates of these issues in children because you have a lot of sicker children coming to get treated at those bigger, better hospitals. But if you take everything into account, I think it's safe to conclude that in poorer North Carolina counties, you see increased rates of possibly low birth weight and also low birth weight and low gestational age. And you also see higher percentages of African American populations and fewer hospitals and clinics, or less quality hospitals and clinics, which can all affect the health of all mothers, not just Black mothers, even white mothers as well. All women that are living in these areas would be affected by what's going on in these counties. So to summarize what we've looked at so far, an increase in negative outcomes of mothers and children, low birth weight, low gestational age, results in a higher risk of child mortality and morbidity and maternal mortality and morbidity. And a lot of these negative outcomes are influenced by the kinds of healthcare situations you find in these counties. So, summary, factors correlating with these negative outcomes are African American population and the economic well-being of a county and the quality of health care and the number of hospitals you find in the counties. And to conclude, as we've looked at these issues, a lot of solutions, continue because we've talked about these, access to care, health situations in counties and racial disparities, all those are issues we're seeing, but solutions would be providing and lobbying for funding so that hospitals and counties can have better funding and can improve care for all their mothers. Advocate for more organizations within the system, and so all mothers can receive care that they really deserve and need, quality care, and addressing racial disparities and educating health providers and providing access to care plans so that everyone can receive the care that they deserve and the care that they need, and making it easier for mothers to get that care so we have healthy mothers and healthy babies. And for future studies, this is not just related to specifically what I was looking at with African American mothers, but you can test and implement strategies that will improve care within hospitals so that mothers can receive quality care consistently. And one example would be a, not experiment, but a program that California has implemented, training their staff how to better respond to emergencies and how to treat their patients more effectively. And you can also use new methods and new professionals that could make mothers more comfortable. And studies have shown that when you put mothers in a situation where they feel more comfortable when they're giving birth, they are then going to produce better outcomes for themselves and for their children. And so doulas, midwives, and then giving birth at birth centers and home births, all those can take a woman out of a hospital setting and put them in a setting where they're more comfortable. And overall, that can help them to give birth better, and that would help them to stay healthy, help the baby to stay healthy. And there are studies that prove that when you do that, it's really effective. So to conclude, I think we all have been influenced by someone important in our life that's a mom or that serves as a motherly figure in your life. And it can affect some of us maybe in the future, and I think it's something we should all be worried about. So moms are dying, and what are we going to do about it? And I think I'll leave you with that question today.